the annual legislative summit, the fourth in the series of such. Gentlemen of the press, the annual legislative summit on health is a product of the legislative network for universal health coverage. The network consists of national and state legislators with members of the executive arm, both state and national, and non-state actors, collaborating together to provide institutional context focused on the health sector. It is convened annually to provide a platform for Nigerian legislators to confer and to resolve matters pertaining to the resilience of the health sector so that the sector could provide equitable, quality care to citizens. The overall objective of setting up the network, the legislative network, was to effectively leverage statutory functions of the legislator in Nigeria for improved health financing, effective and efficient utilization of such resources toward universal health coverage. The specific objectives include to achieve improved appropriation to health sector by deepening the knowledge of legislators on economic, social, health, and political benefits of improved health funding towards universal health coverage. To ensure prompt and adequate release of allocated funds by working with the lawmakers to make relevant central budget agencies accountable for fund releases. To ensure timely passage of relevant high-quality health laws, especially the legal framework for state-supported health insurance schemes. To leverage oversight and accountability function of the lawmaker to assess and improve quality and efficiency of implemented health projects irrespective of the funding sources. And finally, to enhance sustained learning among legislators across states and between state lawmakers and their federal counterparts. Thus, the summit is one of the tools used by legislators to collectively strategize on how to achieve the above objectives. Every year since the first summit was convened in July 2017, we have had it since 2017, 2018, and 2019. The last one was actually November, December 2019. There was none in 2020 because of COVID-19 pandemic. Legislators have gathered with this singular purpose. They've been able to rub minds, discuss, analyze health situations in the country, and they'll be able to take and make decisions and take stand on the way forward to solve whatever challenges that each state of the federation face as far as health sector is concerned within their respective context. What ensures success and nationwide reach is the fact that it includes all states of Nigeria. We have legislators representing the relevant committee that are relevant to those objectives. That is the health and appropriation, as well as the leadership of both the national and the state assemblies participating in the conference. It identifies the role every stakeholder needs to play and leverages this to achieve identified objectives. A major output of these meetings is a strategic framework called the Legislative Health Agenda, which is an actionable work plan developed by each state to address existing challenges in respective health sector by applying their statutory functions of legislations, appropriation, oversight, and representation. These actions by the legislators have become critically necessary as the country's mortality indices have remained extremely high with minimal improvement, despite the magnitude of resources contributed or allocated to improve the statistics. For instance, the National Demographic Survey 2018 findings reveal that in the 7 years preceding the survey, infant mortality rate was 67 deaths per 1,000 live births. Under 5 mortality was 132 deaths per 1,000 live births, and maternal mortality ratio still remained high at 512 deaths per 1,000 live births. Similar poor indices are recorded across different health indicators, and this calls for accelerated responses, like this one that we are having, across different spheres of stakeholders to address the challenges giving rise to these unacceptably poor indices. Despite this, the summit has contributed a large portion to the following achievements in the sector. One is the accountability for implementation of the Basic Healthcare Provision Fund guideline in line with National Health Act. The annual physical appropriation, inclusive of the Basic Health Capitation Fund, which is 1% of consolidated revenue fund, to provide a minimum package of basic health to all Nigerians since the first summit was convened. It's not only the appropriation, but I must say that based on the outcome of the summit, the Basic Healthcare Provision Fund, which funding started in 2018, following the first summit, was initially put under service-wide vote. But since 2020 budget, with the effort of the current dispensation, the current health committees of the National Assembly, it has moved from statutory-wide vote, from service-wide vote to a statutory release, in which case 100% of Basic Health Provision Fund will be released because it's statutory vote now. It's a statutory allocation. It's what we call above-line allocation. Because unlike in the past, the first and second releases were discretionary. It will be based on budget performance. But based on where we are able to move it since 2020 budget, it is 100% releases that are achieved. The other accomplishment or achievement is deliberate action by the legislators on health and nutrition, resulting in budget releases to the health sectors in sub-state for nutrition activities. 34 out of 36 states have enacted legal framework to provide financial risk protection on healthcare. This is what they call either various names, health insurance, contributory schemes, and so on. We have 34 out of 36 states have been able to achieve this. And a high percentage of legislators across the country now keenly aware of how to apply themselves and their statutory functions towards healthcare financing reform. The capacity building of legislators in 5 geopolitical zones of the country to harness and align their statutory functions to achieve universal health goals and nutrition. I must say, part of the achievement is also what we have experienced and seen in the response of the country to COVID-19. As you will see, based on their collective working relationships as committees of health in the National Assembly and relating with the state and engaging with the executive arm, this country as one of the countries in the world that have been able to address COVID-19 very, very well. Although the country is making an attempt to take down strand in the pursuit of universal health coverage, this effort and whatever achievement have been recorded could be quickly eroded if health security is not prioritized. This is obvious in the effect of the current ravaging COVID-19 pandemic and other disease outbreaks that have greatly impacted the health system negatively. The approach is to ensure that health security is prioritized and at the same time, the country's universal health coverage pursuit is not hindered. It's the focus of our discussions at this year's 4th Annual Legislative Summit on Health that we hold from May 23rd to 25th, 2021 in Abuja. Its theme aptly described the purpose: universal health coverage and health security, two sides of a coin for an efficient health system. During the summit, we will review the state of the health of the nation and the national health system, the role of adequate financing as the nexus for universal health coverage and health security in Nigeria, and what opportunity exists for health sector to leverage and leveraging lessons from COVID-19 national and subnational responses to improve the health security landscape. As you are aware, just like we learned from the polio eradication initiative, the COVID-19 response or the COVID-19 pandemic exposes to even the other policymakers, like as you saw several times, the Secretary to Government of Relation lamenting that he wasn't aware the kind of deficit we have in our health infrastructure. So we will be able to use the opportunity of COVID-19 to improve on that infrastructure, using the instrumentality of our statutory function of appropriation. At least if we have similar outbreak now, like for example, when COVID-19 broke out, we had only 2 labs that could do molecular lab testing. As we speak now, we have more than 90 labs, both private and public. And in terms of public, every federal government-owned institution, 52 of them, they all now have a molecular lab. They all have isolation center, which can accommodate minimum of 30 beds, and they all have ICU of 10 beds with all the functionalities, using the varieties of the financing that we'll be able to get. But in addition to that, there's always been a lot of capacity building and so on, which I'll be able to achieve. So, but we can't rely on that. Those are not the only issues that we have in the sector. There are several other things. COVID-19 also exposes us to see, you can see that at that time, nobody can travel out. So even medical tourism and so on was not possible. It means we have to look inward to improve our infrastructures, to improve the equipment and facilities available, as well as the manpower, and motivate such manpower to be retained and stay in the country. It is our sincere hope that this year's summit will build on the past successes to impact positively on the health sector and Nigeria as a whole. The summits have continued to be a rallying point of learning, interaction, and agenda setting for legislators and other key actors in the health sector across the country. They have helped achieve laudable accomplishments in the provision of equitable and affordable health care in the country, and will continue to be used to this end. With the continued assistance of our partners, including the World Health Organization, that's WHO, the European Union, the World Bank, the United States Agency for National Development, the Foreign Commonwealth and Development Office, that's the UK Development Agency, Bill and Melinda Gates Foundation, the Health System Consult Limited, Christian Aid, the West African Academy of Public Health, Nigeria Health Watch, Farm Access, Stop TB Partnership, International Society for Media and Public Health, Health Reform Foundation of Nigeria, Health Sector Reform Coalition, the LISDEL, and the DGI Consort, to mention a few. We acknowledge and appreciate all their contributions and their partnership over time in the health system. Because when you say with fund, there is no special fund known as COVID-19 fund. There was a budget in the 2020 amended appropriation, which is said to be COVID-19 intervention fund. Now, that fund in the budget is not only for health sector, it's a multi-sectoral thing. It includes the humanitarian ministry's allocation for all these social interventions. It includes Ministry of Environment intervention. It includes information activities, and even agriculture. So it's a total of 500 billion. But what is in the health sector was actually just 86 billion. It's 126. But even before the budget, some of the initial expenditure affected by the government on the authority of because nature does not above vacuum, the president gives some approval, but it must be captured based on the Constitution. So the total was 126 billion, which we approved. Yes, the answer to your question is that's what I'm able to explain to you. Not only with PTF, with all the relevant other relevant agencies of the health sector, the Ministry of Health, the Finance. We have had several meetings with them. Some of you have covered it, both on the allocation, on the releases, and on the implementation. The one for the health sector, they are very easy to be able to see because they are based on two categories. The first category was the actual interventions which were being done, which include, they have what they call the pillars, the laboratory, the case management, what we call it, publicity, and so on. So that one is the only one managed by the PTF. So this one includes what the PTF used to be able to procure testing kits and so on, and what they pay to hospital for every case of COVID-19 that is treated by our hospitals, public hospitals. They give them money to take care of because the treatment is free. So that we will be able to look at. But there are other parts. When I was reading my address, I mentioned the issue of those facilities that are being provided in teaching hospitals. There are three categories of them. The molecular lab, the isolation center, and the ICU. But in addition, we have certain allocations to agencies for them to get prepared to improve their infrastructures, which are Nigerian Institute of Medical Lab Research, Nigerian Institute of Pharmaceutical Research, NAFDAC, and NCDC. These are agencies relating to, which will come to the issue of vaccines, to come to the issue of research, and it will come to research in terms of, because that will partially answer your question. It's not only COVID-19 and its question. These allocations to all these other agencies is to prepare, they are research institutions and regulatory bodies. The two research institutions, Pharmaceutical and Medical Research Institute, they are able to acquire modern and latest equipment that enable them, when if we have similar pandemics or things that happen like that, for now they will be able to do research. And NIMA has even been able to apply that. NIMA has come up with test kits and so on, which we have had interaction with them. NAFDAC is ready. That's why NAFDAC can test COVID-19 when we have it now. NIPRID, you will recall, they are the one that tested the so-called Madagascar concussion and so on, and they submitted their results to WHO and so on. Based on that, even they got grant. So we allocated resources to this to improve our infrastructures and to get us in a better state, not only for COVID-19, but for any other similar diseases. But in addition to that, part of that funding is also to continue to do the ongoing response. So to answer your question, we had interaction not only with that, but I must say that it's not all the funds that have been released yet. We have that information. In fact, it's one of those things that we have asked our link person. For all those infrastructures, the only release that has been made so far was 50%, and that will be utilized. But we want the final release to be made. We have conducted some oversight, but we will do more. The executives themselves are conducting oversight. One of the reasons for delay of the release of the last 50% is because, being an intervention fund, the Ministry of Finance itself constituted a monitoring team that went around institutions to check that those funds released are utilized for what they are meant for. So that is it. We don't just, for this one, as committees, we didn't just approve and fold our hand. We are actually monitoring and following what is happening. Now, Guardian, other challenges. As I said now, the response to COVID-19, we can see that the response, as far as appropriate is concerned, is special, is international intervention. It does not affect the other functions of the health sector. Rather, the sector benefited from the 2021 budget. The allocation to the sector was higher than what we got in 2020, which shows that at least we are using the opportunity of that COVID-19 to see that the sector requires more funds. In addition to that, there are efforts to be able to look for other extra sources outside the budget to build at least one center of excellence per geopolitical zone to be able to stem the tide of health tourism, which will address that. But in addition, as you may be aware, there are all kinds of discussions on, particularly the challenge we have with human resources. You know, within that, even that COVID-19 intervention fund, especially about 20 billion there was to pay to the health workers for their, what they call hazard allowance. And it wasn't enough because the plan was to pay it for the first 3 months, that money when they calculated it. So subsequent months now, they are owing them because it's not in the budget. So they are looking for money for that. That's one of the reasons why the residents went on strike, while some nurses want to go on strike. So what I'm trying to address is that COVID-19 is an opportunity for us to address our infrastructure. But it doesn't mean that we have closed our eyes to all other things. As legislators and interacting with the government, we continue to look at other issues. And when you say, your end question, COVID-19 is, there's no way, as human beings, when we live, there will be another pandemic. It is when it will be. The only important thing is that how prepared are we for that pandemic? This one we have now is a viral infection. It could be any other kind of things, but mostly it's viral. But we are more prepared now because the molecular test we are talking about is to test virus. So if we have something like that, it will be very easy for us. But overall, with all sense of responsibility and humility, we have done very well as a country to respond. India, you can see it's far bigger, and we always talk about India. Nigeria goes to India for healthcare, isn't it? It's one of the centers for tourism. See how they have handled COVID-19. See what they are suffering now. We didn't suffer such because we'll be able to meet with it. Now, that brings me to the last question on vaccines and the fear and so on. The first thing is to say that it is a misplaced, I don't know how to put it, it is rather fake news to say COVID-19 vaccine will harm anybody and because it's foreign. Which other vaccine do we produce in Nigeria? Everybody here, most of you have children. Your children must go and take what we call the childhood immunization, BCG, oral polio, DPT, that is diphtheria, pertussis, and so on, and then even the Movilox influenza and so on. All these vaccines, are we producing them here? Are we taking them, giving them to our children? Why are we not having fear to say that that will be contaminated?
Why wouldn't those ones have been used to kill us more? If you have to travel, you take yellow fever. We used to produce yellow fever here, but we don't produce as much, but we still take it. If you don't have yellow fever card, you don't take yellow fever, you won't travel. So why is that not used to kill? So the answer is first and foremost so that you disseminate. As scientists, we have said this several times. Nobody will deliberately go and put something to kill somebody. The process of manufacturing, the process of approval is transparent. But besides, and more critical and important is that as a country, that is why we have regulatory bodies. Vaccines that are being used here, when they came in, you didn't just take it and start giving to people. Our own regulatory agencies tested it, verified it, and saw that it is safe, and that's why we started giving. In addition, there's continuous monitoring to be able to see what effect it will have. And there has not been any report of even any what we call adverse effect. Adverse effect is what is not normally seen, which can happen as you assume all of us here, we're all different. So the ordinary Panadol, what we call ordinary Panadol, somebody can take it and can react to it in a very bad way. As a practitioner, I've seen people that died from taking Panadol from adverse reaction. So does that mean that Panadol will not be taken by all again? No. So talk less this one, so far, there's not been any report. So I'm emphasizing that so that the media will use this opportunity to tell Nigerians that the vaccine is safe. Let us not follow all those fake news. And there are politics in terms of the fake news of the news. From foreign, not from Nigeria alone. Because people are putting politics into it. You can know in America because of their politicking and so on. But secondly, which is more important now, is that either one likes it or not, you have to take vaccines. I just came back from visit to Saudi Arabia. One of the things that allow us to be able to enter the mosque in Medina is our vaccine card. Because there, they created, what do you call it, an app that will test you. But even if you are negative, there are more confidence if you have taken the vaccines. So if you have the green COVID-19 vaccines, you are allowed. If you don't have it, you are not allowed to enter. So it means if you like, if you don't like, if you don't take, that means you only remain in your house. You remain in your country. Now to your last question. Local production is very critical to us. That's one I reserved that. Part of the fund, part of the first question I asked, 10 billion naira was allocated for improving local production of vaccines, in addition to what was allocated to NAFDAC, to strengthen their ability to be able to test. And this committee, the joint committee, will work to be able to see how that will be effectively be utilized, so that not only to produce COVID-19 vaccine, but for us to produce vaccines for other diseases, particularly if all those ones I mentioned that we are importing now, so I'm able to produce them. The decision of the committee was that there was before an effort which started, is it 12 years? More than 12 years. It started during the Obasanjo's regime, but subsequently, there has been challenges with it. We have now revisited it. So there was a PPP arrangement between the government of Nigeria and one private company to constitute a joint venture, which is known as BioVaccine. So, and the national infrastructure was what the government provided as their own counterpart, and the company brought money. So we went to look at it carefully, and we have been able to see how we carefully utilize part of that fund for that. But in our own opinion, which is what we recommended, we felt because that venture, the government has already put enough resources, the government should only put minimal, so that the private sector also should be, you shouldn't just give public money to a company. So the company should also should be counterpart based on the law and the agreement. So the other part of it, we now want another venture to be created so that we can have dual capacity. Because for a country as big as this, with our geographical spread and so on, one production center is not enough for us. So that's the effort we are making. And we want to follow up this with subsequent budget to see that we are able to ensure we have local production. Just like I said, in the past, we are producing yellow fever vaccine in this country. So, and we have the technical know-how in terms of the human resources. What we only need is the equipment and the necessary infrastructure to be put in place. So we are making this effort. So thank you very much.